And we should. Good job.
Sure. Yes.
My
name is Angie Sullivan. I am the program manager for the Health Infrastructures and Learning Systems online degree program. Welcome, everyone. It's great to see you on the call.
Yeah, and I want to thank you for being here at noon on what day? Tuesday. My name is Karen Stahlberg, and I am the director of the Health Infrastructures and Learning Systems, or HILS, as we like to call it, online degree program. I'm also a practicing obstetrician gynecologist here at the University of Michigan Medical School and the Medical Center. So without further ado, I want to go through this sort of brief information session in terms of slides about the degree program, and then we'll have plenty of opportunity for discussion and questions and clarifications. If at any point you have any concerns, please definitely put things in the chat. I'll speak first, and then Angie will join in afterwards. And there we go. So why is the HILS program unique? Well, what's unique about it is that, first of all, it's the one and only kind of its program in the United States because of its joint emphasis on information and social sciences to improve the health of individuals and populations. So the goal is for us to develop people who are going to be leaders and professionals in learning health systems and implementation science by creating those innovative solutions that are going to address some of the most demanding healthcare challenges. What's nice about this is that we're online, and so you have the flexibility to complete a full master's program in 1 year as a full-time student, or in 2 to 3 years as a part-time student. Because this is a fully online degree, you actually don't need to leave the place and space where you are, and only have to come to Ann Arbor, which is such a hardship, not really, for 2 to 3 days, about 3 times in the course of the degree program for in-person institutes. And we'll talk more about that. So the first thing to say is that our program, HILS, actually started as a PhD program. And so we have students hailing from all over around the world and the United States. Because HILS online master's program is online, there are rules and regulations that we have to follow. And so we're only able to admit United States citizens and residents to the program. But we do have learners from all over the world. The educational backgrounds of our students are very diverse, which include the obvious usual suspects, right? Health science professionals, but folks who are also interested in information, computing, engineering, behavioral and social sciences. And because we're talking about learning health systems, folks who have expertise and interest in organizational and policy sciences as well. So I'm proud to show you our current cohort, which is the inaugural cohort who enrolled in fall of 2021. Very diverse group, some of whom are recent college graduates. We have a pharmacist who plans on using implementation science and human factors science to improve decision support. We have a medical director who is building educational systems for clinicians around electronic health records. We have a senior level executive who's a CIO at a large health information network, looking at the national impact of learning health systems for community health centers. We have a recent graduate from our PharmD program who's really interested in pharmacogenomics and clinical decision-making and how that can be included in electronic health records to improve and implement appropriate chemotherapeutic agents. And we also have someone who's a healthcare professional interested in learning health systems in order to improve patient outcomes and standardization. Boy, you would think it's a Monday, of EHRs. So when we talk about learning health systems, we think about the cycles that a learning system goes through. And so this is sort of the foundation of the curriculum and also our understandings of how LHSs function. So there's a health problem of interest, some big, hairy, audacious thing that is problematic, whether that's out of hospital cardiac arrest, diabetes management, maternal mortality, right? Lots of big problems, sepsis, how many beds we might need in a pandemic, right? The learning community forms, and so we sort of start here with the formation of a learning community that is interested in this health problem. And we look at performance to data, meaning what happens as care is provided. We then take that data to try to understand it and develop knowledge to help us find the evidence to change our performance and sort of cycle it all back around. Another way to think about it is using healthcare data for decision-making, using policy and ethics to understand how that data is actually used, sharing the knowledge that's developed to improve our systems, and then using the implementation science to really create methods and processes for promoting behavioral change. And then are there ways that we can actually create technology infrastructures or capabilities that make change happen without people actually having to do things? So what's nice is that all of the courses in the HILS degrees, in all of the degrees actually, circle around this infrastructure. So much like our Taubman Health Sciences Library is a beautiful building without actual books physically in it, our HILS online degree program is actually the same degree that people take on campus in our residential course, except it's all now online. So people complete 27 credit hours as well as a learning cycle project that applies the information that you learn from the HILS content into real world scenarios. So again, this is a Master of Science degree program. And so you end up with a Master's of Science in Health Infrastructures and Learning Systems from the Michigan Medical School. You have asynchronous learning opportunities primarily, but there are synchronous options to connect with classmates for class projects, in-person opportunities for mentoring. All of the content is through the Canvas Learning Management System, which gives you the opportunity, number one, to sort of time and pace yourself the way that you need to for your other commitments, and then review challenging information or lectures repeatedly. The one thing that I would do in terms of math is consider to spend 8 to 10 hours per week per course. Some of the courses may be really heavy on reading or writing or viewing other recorded materials. There may be group projects that are important. So really making sure that you've built in that time week by week is important. So this is really what it looks like when you interface on the Canvas platform. Like I said, the assignments can be instructional videos, recorded lectures, overviews of modules, discussions, quizzes, papers. It's just like any other educational program. But the thing to realize is that real people from the HILS program are teaching you in this course. So this is a picture of Ann Sales, who's one of the country's experts actually in implementation science, who is one of the professors who teaches in the implementation science course. We also think about your learning cycle project. So you're coming from a place or a space within a health system or within an education system or in a sort of computer environment, if you will. And so thinking about, well, what's your health problem of interest? How can you, in concert with your advisor, think about a project that you can do in about 8 to 10 weeks that you can spend in the spring summer term going through the project and reflecting on your experience. So here's a quick example from one of our learners, Rama Manwese, who actually is now a PhD candidate, who looked at patterns of surgical count related incident reporting behaviors and barriers among OR nurses. So the health problem of interest that he was interested in is this sort of never event, which should be surgical counts being incorrect because some sort of instrument has been left behind. And so thinking about how do we report these surgical case incidents and why are we not finding them? And so he did a qualitative study trying to understand the barriers to reporting. And once you understand the barriers to reporting, then you can look at sort of root cause analysis, understand ways to help improve the process, and then recycle again through, okay, let's do these educational interventions, these sort of behavioral interventions, documentation interventions to make change. So Catherine Irwin, who graduated in 2021, said that the project illuminated how the core curriculum offers a comprehensive but practical framework for creating this cycle. Her cohort was actually residential and was interested in clinical and community topics, but she really was interested in the data component. But the truth of the matter is that the degree covers all of it, right? So this could be an example of how folks would go through the program in a one-year plan. So notice that you could take 4 courses, 3 credits each. So that's 12 credit hours. So if you do the math, right, 4 courses, saying 8 to 10 hours a week, that's pretty much a full-time job. So if people have other full-time jobs, then thinking about going part-time is also an opportunity. And so this is what it would look like if you did a 2-year plan. You could do 6 credits in fall and winter, the capstone course in spring, summer, and then finish again fall and winter. Remember that here at the University of Michigan, our fall term sort of starts the end of August and goes into mid-December. Winter for us is the beginning of January to sort of early April, and then, or actually mid-April, and then spring summer is from May to mid-August. So let me do a little bit of a deep dive. I just want to point out this picture. So there's Rama right there. And here is the associate chair of the Department of Learning Health Sciences and also the grad chair for HILS, Gretchen Pyatt, who herself is also an implementation science expert. So the courses that you'll take are around the whole cycle and include health infrastructures and policy focused courses, courses around implementation science, including ethics and policy issues. We also are pretty strong on data science. So thinking about data analysis, how data is represented, and how informatics can help inform that. Again, real people. This is Dr. Chuck Friedman, who is the chair of the department and sort of the mastermind behind our degree programs, as well as the concept of learning health systems. And then we also have an opportunity for research methods. Grace here, as you see, is one of our PharmD students, as well as now a HILS soon-to-be grad. And she chose this because it's a forward and futuristic approach to how we're going to manage healthcare. So we do have in-person campus institutes. This picture is actually from this past fall, where all of the HILS faculty and all of the HILS learners, whether those are PhD students, HILS residential students, or HILS online students, attend the institutes. The goal of being in person and being on campus together is really to reinforce the current coursework, but also to provide networking and mentoring opportunities. We have active learning sessions. We plan on skill development. We make sure that you have time for one-on-one mentoring in person as compared to the sort of online opportunities you've had earlier. And then we're pretty social, so we really like to have the opportunity to connect with peers and program faculty, as well as the residential students, because the HILS learners, whether on residential courses or online, are learning the same material, often from the same faculty who are sort of doing double time in real time as well as online time. So the goal for this master's degree really is to lead and change and transform health, and to provide skills that lead to improved quality, safety, infrastructure, and promote learning. And we really see our graduates as being the improvement and implementation leaders in these new learning health systems. So in terms of careers, I think the sky's the limit, in all honesty, because there's nobody in this space yet, right? People are talking about learning health systems. They're talking about getting data to create real-time improvement and implementation science in creating change. But there's not a lot of people who are trained in all of those elements. And so somebody who graduates from this program will have the opportunity to be a leader in learning health systems as well as implementation science. They're going to be a health system innovator, a quality improvement expert. They're also going to know the learning informatics data and design and analysis. It doesn't mean you have to be an expert in data, but it means that you'll have the language and understanding to talk to the chief information officer or the folks who are building electronic health records so that you can actually converse with them and understand opportunities and challenges, right? So our graduates now are all over the place. Some have gone into management consulting and have become entrepreneurs in this LHS space. We have folks who are data architects, clinical research coordinators, analysts. We have folks who are teaching in academic environments. And then be very careful because we are kind of a little bit like a tractor beam, and some of our master's students have gone on to become PhD candidates. So at this point, I'm going to hand things over to Angie, and we'll be back for questions.
Great. Thank you, Dr. Stallberg. So I'm going to cover a few of the student services side of things. So to begin with, advising. So students are paired with a faculty advisor who have live office hours, and these are typically via Zoom, or you can contact them via email. So as Dr. Stallberg mentioned, you're going to be taught by and mentored by the same faculty who teach in the residential program. So for example, here is pictured Dr. Rachel Richardson at our HILS Online orientation in August. And she's a professor in our department and conducts research on quality and usability data from electronic health records. So here she's advising one of the new HILS Online learners who has an interest in learning health systems to improve patient outcomes. And you'll also have easy access to me as a program manager through email, through individual and group meetings, through Slack, through the HILS Online community page and Canvas. So there's a variety of ways to get in contact with me and Dr. Stallberg. And the one thing that I did want to point out is, even though this is an online program, you will be supported by real people, as I mentioned, such as myself, Dr. Stallberg, and the other faculty, as we really want to make this a full learning experience as a Michigan student and ensure that you become part of the community. So being a student in our online program, you will have access to an abundant variety of student support services, such as the Rackham Graduate School, which has student communities such as students with children, students with disabilities, LGBTQ+ students, health and well-being resources. We also have the Office of Graduate Postdoctoral Studies support, which overlaps somewhat with what Rackham offers for resources, such as health and wellness, diversity, equity, and inclusion resources. And you'll have access to other university resources, such as counseling and psychological services, Taubman Health Sciences Library, in addition to all other libraries on campus, Students of Color of Rackham, and listed here are just a few of those resources. So you'll see there's really an abundant variety of student support services for all of our online students. So tuition information, this is based on the 2021-2022 academic year. And please note that tuition and fees often change each year. So again, these are based on this year. So typically a student is going to take between 6 to 12 hours, 6 hours being part-time, 9 hours or more is considered full-time. So for example, if you're a part-time Michigan resident, tuition is $7,301. And if you're a non-resident taking 6 hours, which is part-time, it's $10,331. For full-time, 9 hours tuition is $10,859 for Michigan residents, and it's $15,404 for a non-resident. Then for each additional hour after that, it's $1,186 for a Michigan resident and $1,691 per credit hour for a non-resident. Then there's also mandatory fees assessed each term, as you'll see here, registration fees, central government, et cetera, for a total of about $164. So we wanted to break it down for you even further. So if you were to complete the program in 1 year, this is what it would look like. So as a Michigan resident, that first semester fall would be $14,417. That second semester winter would be $14,417. And that spring summer term is $3,743, giving you an estimated total of $32,577. And then as a non-Michigan resident, that fall semester is $20,477. The winter term is $20,477. And then the spring summer term is $5,258, giving you an estimated total of $46,212. And again, this is based on the 2021-2022 data, which is subject to change. Some additional expenses that and technology needs that you'll want to consider: study materials such as the usual stuff like books, notebooks, things along those lines. And often a lot of the books that are used in the courses are offered online for free, or they're actually included in the course in another format. You'll need a high-speed internet service, computer equipment and software. What's recommended university-wide is a webcam, RAM of 4 gigabytes, microphone, headphones, compatible browser. And then additional expenses will be for travel expenses, like Dr. Stahlberg mentioned, where you will be required to attend the in-person institute sessions. The application requirements: we require a bachelor's degree with 1 statistics class, a personal and academic statement of purpose, a resume or a CV, transcripts, and then 3 letters of recommendation. And for these letters, you'll want to choose people who know you well and those that can provide an evaluation of your ability to perform and succeed at the graduate level. And often that might include a manager or supervisor from school or work. And at least we're looking for 1 letter from a past or current professor or academic advisor, someone with an advanced degree who has supervised you, say in a job or an internship. And I also wanted to note that the GRE is no longer required. So I'm going to provide some tips to you for your statements. I want to start with the academic statement. And this is where you'll want to focus your primary research area of interest. You'll want to reach out to potential advisors, 2 to 3 HILS faculty, and you'll want to introduce yourself and discuss the potential fit to our program. And you'll want to do this before completing your academic statement purpose. And you can read about each of our faculty on our website and choose those that are perhaps doing research or teach in an area of interest to you in that statement. And then you'll want to explain why you identified the potential advisors you did and any interactions you had with them. And in addition, you'll want to describe your understanding of learning health systems and what interests you about them. Describe any prior research experiences, courses, or projects that have prepared you for graduate study. So all this is covered in the actual application, so you don't need to remember it right now. So then with your personal statement, this is different than your academic statement. And this is where you'll get the opportunity to explain how your background and life experiences, other opportunities or challenges have motivated your decision to pursue a graduate degree at the University of Michigan. So this should be more of a discussion of your journey that has led to your decision to seek a graduate degree. So you want to make sure that you do not repeat your academic statement of purpose here. And we have some resources on learning health systems that can help you with your applications that I will send to you in an email after the session. In addition to all the other information that we discussed today, I'll forward that to you as well. So to begin with, we have a couple of journal articles. This first one, Development of the Learning Health System Research Core Competencies, which discusses how the core competencies for learning health systems were developed. Next is a journal article written by the chair of the department, Dr. Chuck Friedman, the picture that you saw earlier, and Josh Rubin, who is a program officer in our department. The title is Weaving Together a Healthcare Improvement Tapestry. Learning Health System brings together health IT data stakeholders to share knowledge and improve health. So you'll definitely want to be sure to check out that one. And in addition, we have a website link to the Learning Health Systems Open Access Journal. This is an open access journal that is freely available to read and download. And last is the Agency for Healthcare Research and Quality Learning Health Systems website, AHRQ. And this is an agency that funds LHS researchers. And here you can go to learn about different types of research that is funded by the agency. So again, I'll be sending you all these resources after the session today. So a few application tips. Please be sure to proofread your statement carefully, ask a friend, a colleague, or a mentor to also review it, just paying special attention to those typographical errors, grammar, punctuation, and overall clarity. So since we are a Rackham program, you will apply through the Rackham Graduate School website and complete their online application. And then on the site, you'll upload materials in addition to sending, or if you need to send them to us, you can do that as well. And we have 2 deadlines. The first is February 1, which is already passed. And all applicants who applied by this deadline were eligible for priority scholarships. Those scholarships are merit-based and candidates are reviewed holistically by the admissions committee. And then June 1st, which is coming up quickly, is the final deadline to apply. So we aim to notify applicants 6 to 8 weeks after the receipt of the application. So please go get those in as soon as possible. And as far as transfer credit goes, at this time, we're not allowing credits to be transferred. However, if you've taken a course that is equivalent to a required course for the program, we may be able to review options for substitute electives or other course options. And here is our contact information along with our website. You can find a lot of the information on the website. In addition, feel free to reach out to Dr. Stahlberg or myself at any time with questions. So at this time, we'd like to thank everyone for coming, and we want to open up for questions.
Thanks, Angie. So feel free to unmute or put something in the chat. We're here to help explain, because we know that the concept of learning health systems is pretty new, and definitely a degree program in health infrastructures and learning systems is really new.
Hey, I had a question. My name is
Hi,
Krista. Hey, thanks so much for that really great presentation. I am a non-medical professional. I'm an artist, and I attend Stamps there at University of Michigan, and I'm interested in showing data through my art. Is this a program that could be kind of completed by people who may not know much about the healthcare industry?
Oh, that is an excellent question. And my concern is that it probably would not necessarily be a good connection because it's so grounded in healthcare systems. Now, that being said, we do have lots of courses that talk about what are our health systems, what are the ways that data is sort of structured within a healthcare system. Sort of how that is applied to questions around health. I would be really happy to have a separate conversation with you to kind of understand what your interests are in, data through art. I'm really, really intrigued, actually. Which is why you hear that hesitation in my voice, because my head is spinning a million miles an hour right now, particularly in the ethics, as well as how do patients understand data? How do they access their own data? Who owns data? All of those kinds of things. Please feel free to reach out, for further conversations. Absolutely.
Oh, I would love that. Thank you so much.
Looks like we got a question in the chat from Alexandra. Thank you for putting that there. It says, I believe you showed a 2-year part-time schedule. Is it possible to complete the master's program by taking 1 course per season rather than 2? So, Alexandra, I would say that anything is possible, right? But there are some caveats. So certain courses are only going to be offered in certain terms, meaning it's not like you can take, so only winter courses are offered in winter, which means if you don't take them in sequence, then that sort of delays even further how long you would need to complete the degree. The other challenge is that with every year that you take to complete the degree, in all honesty, the costs go up. So it's like a return on investment kind of thing in terms of going, like we thought the best sort of part-time piece was doing 2 courses at a time, which would then get you to 18 months. I think if you did 1 course at a time, that could push you into 4 years, which may actually be a lot longer than you would want, and would also just put you out of cadence with sort of everyone in your cohort. Do you have a follow-up question? Feel free to unmute.
Yes, thank you very much for that explanation. I was also wondering about what time of day the classes are offered. I'm working 40 hours, so I'm trying to figure out what I'm able to do.
Yeah, that's awesome. Thank you for that qualifying question. So when we say asynchronous, what we mean is there is no time of day. So it's not like you have to be in class on Tuesdays from 2 to 4 p.m. What happens is that the modules are released once a week. And so all the content is just released, right? So you can watch all the videos, you can do the homework, you can do all of it at your own time and schedule. There are deadlines in terms of when you need to submit an assignment, or when you might need to interact with your colleagues in terms of a group assignment. But a lot of people who are working full-time and taking, 2 classes end up doing a lot of the work in the evenings, or pre-working on the weekends when things are released. If that makes sense.
Yes, thank you.
Other questions?
Yes, my name is Nora. I'm wondering if there's anyone to talk to about personal circumstances and whether that would make me a potential possibility as an applicant. I would be returning to education after working in healthcare for 24 years. And then now I'm recently out of the workforce after having a baby, but we'll be getting back into it. So I don't know if there's, in terms of like getting a reference that might be academic related, or would coursework be too old? I'm just trying to figure out what would be, I guess, my personal circumstances, whether it makes me, not even someone to consider this because I'm too far out of education and not currently working.
Yeah, so I'm not going to endorse that because what we do is a holistic review of applicants. And so if it's really clear in your academic statement of purpose, as well as your personal statement, what your unique situation is and why you're drawn to this degree program, transcripts last forever, basically. You just in some ways have to pay a fee to the institution where you were trained to get those. Angie, do you want to speak to, references or, while your new kiddo cannot kind of provide recommendation for what an awesome human you are, there are definitely people in your environment who can do so.
Right.
Yeah, and we would also recommend like if there was a stats class required, so we would want you to look in taking an intro to stats class, like maybe at a community college or something, like the summer before you matriculated. As far as references, and we can work with you on those. I would definitely suggest either setting up a time to speak with myself or Dr. Stahlberg, and we can go over kind of what you're thinking and who your references are, and work with you individually and get you set up for your application.
Okay, great. Thank you.
Yeah, and many of the learners who are going to be in the second cohort are actually also returning to education. So True story. So 10 years after I finished my OBGYN residency, I actually went and got a master's in higher education at our School of Education, and sat in courses, that actually were real time with 21-year-olds, which was awesome. However, Rackham labeled me a chronologically advanced student because I was not somebody who had just come out of undergrad into a master's program. So I know what it's like to kind of be working full time. I would go sit in class post call, really caffeinated to get through class. And so that's sort of where the birth of like, can we do this a different way where people don't have to, give up time and space to do this. Anyway. So yeah, Nora, definitely connected with Angie, and we can go from there. I think, Morgan, you unmuted, which is often the universal sign of wanting to say something. Rohit, are you interested in commenting? Please do.
Yes, I had a question. My name is Rohit. I'm a pediatric hematologist working in Memphis. I guess my question is a couple of things. I didn't quite get the how the 3-year program is split up. So if you can speak to that, because it's unlikely that I would be able to do it all in a year. And my next question is when I think about health infrastructure and learning systems, how does this course differ from other available programs that are purely on implementation science?
Mm-hmm. Yeah, great question. So let me start with the first one because that's easier. So you need 27 credit hours to graduate, and how you divide that up is math in a way. What we showed was a 2-year program where you took 6 credit hours in each semester, which sort of ended up spanning into 18 months. If you did, 3 courses and then 1 course, right, it's just this combination of when things are offered and how long it takes. Most of the courses are not prerequisites for one another. So if you, it's not like you have to take a specific course in fall to be able to take a specific course in winter, right? So you can mix and match, if that makes sense. And your advisor can really help you kind of sort of mark out the path as to how you might want to take courses. In terms of the difference between a degree in learning health, in health infrastructures and learning systems, and online programs that might give you a certificate in implementation science or a degree in public health or like that kind of thing. This degree includes not only the data infrastructure, the capabilities of understanding and querying data and representing it for actionable information. So for instance, one of my colleagues is really looking at antibiotic sort of utilization and understanding how to represent how people are using antibiotics to them so that they can then make appropriate choices. Maybe they need just-in-time learning to improve their selection and then continuing that cycle through. The unique component is on implementation, which is how do we take evidence-based practice or evidence-based understanding and knowledge and implement it into a complex organization, and then set up structures so that we can monitor that implementation and make changes in real time or make adjustments year over year. So that's the difference, I would say.
Thank you.
Yeah, absolutely. Other questions? I do want to say, right, that the thing to understand is that these sort of basic science principles and theory, right, that the courses teach you are applicable in a variety of contexts. So for instance, Morgan, you are right. We were not able to hear you for some reason. I apologize. But definitely type your question in and we'll get to it. So I was already teaching, right, in the medical school. I was lecturing, I was doing things. But what I realized was that I didn't understand why or best practices or ways to improve what I was doing. And really what I wanted was the theoretical base, which is why I went to the School of Education to get that theory and that science of education, whether it was social learning, cognitive science, curriculum design, assessment and evaluation, right? And so that's sort of to transfer, that's what I view this health infrastructures and learning systems degree as, which is that learning the basic science can be applied to a variety of environments. So Rama's working in the operating rooms and thinking about operating room things, if you will, right? I have a colleague who's really focused on data and wants to understand how you can represent data. And so he's working on how do I give clinicians a report about their antibiotic use, right? We have other folks who are looking at predictive modeling to understand when sepsis might occur or real-time alerts to let people kind of know things. We have folks who are thinking about policy and ethics and, you know, what's the ethics of data if folks aren't accessing places and spaces where there aren't electronic health records, and all we're doing is amplifying data that's in an EHR, then actually you're creating more health disparity because the people who aren't accessing care aren't counted, if you will. So lots of questions there. Let me get to Morgan's question. So I took statistics 15 years ago, retaking it for a refresher. Retaking it is, I would say it's a requirement. Like I wouldn't, you know, it's sort of like you wouldn't want to go run a marathon without kind of running some 5 and 15Ks and having a plan for how you were going to train to get to the marathon. Nurse, fantastic. We love our nurses. Thank you. And I've done 1 QI project so far, submitted to a national conference, really interested in quality improvement and patient education. Good master's program to prepare for a future job in quality improvement. So I would say yes, because we have this great debate in our department, and actually we've been talking about it a lot. The similarities or the differences in quality improvement and learning health cycles. And so one of our electives is actually in quality improvement and team science and thinking about how to understand the principles of QI and how that might apply to a component of a learning health system. So if you actually, and this will be distributed later, but if you go online to our website and look at the courses and the course descriptions, you'll actually see that there's a lot of QI kind of baked in there. Angie, do you have any other thoughts? I feel like I'm talking a lot.
No, I was just going to say, as far as this, the statistics course, you know, if we're reviewing the application and we see someone did take it 15 years ago, we are going to definitely require them to take a refresher course.
And we provide you with options, whether that's, you know, like Angie mentioned, you know, at a community college, there are some online courses that through Coursera or other places and spaces that count. So we definitely, like, here's the deal. Our goal is to admit people who sort of understand what a learning health system is, want to become a leader and improver in that space, and are going to succeed in our program. So we're not like a degree mill, right? Like we're real people. The faculty here at Michigan Medicine are the ones who are teaching. You get a degree from the University of Michigan. So our interest is in admitting people who are going to succeed and helping you be successful. as you have questions about the application or about the courses, please reach out to Angie or myself so that we can help. Definitely. I'm looking at the time here because we're at 1:45, and I know many of us kind of hid somewhere to get a noon to 1 conference in. Any additional questions or concerns before we kind of bring this to a close? Please just jump in. Awesome. All right. Well, as Angie said, she'll be distributing the slides and more information and reaching back out to you. If you have questions, please reach out. Angie, any final words?
Yeah, no, and also I'll send the recording of this as well, and the resources that will help you with your personal statement.
Yeah, Nora, I think that's a great place to start. Angie's our expert in student support services. I would just go ask her anyway. So
yeah, I'll get you set up one way or the other with myself or Dr. Stahlberg.
Yeah.
Yeah.
We really want to thank you all for taking the time to learn about the degree program and for your interest. And again, however we can help, please let us know.
Yes, thanks everyone for attending.
Thanks. Have a great day.